before we get started with your welcome, Syexwaliya, I'm just going to ask Aoife to put up a slide just to go through just a quick housekeeping, just welcoming everyone to our second session of the BC Research Ethics Virtual Symposium. And just to say thank you very much for those of you that were with us this morning, welcome back. And for those of you that are joining us for this session this afternoon, welcome. This is going to be another full session. It looks wonderful. Just as far as housekeeping goes, as I said this morning, usually housekeeping means where are the bathrooms and where can we find coffee, but in this case, we're just going to focus on how we're going to use Zoom for this meeting. So we have Zoom chat available, so people will be muted when they enter the room. We'll be muting you, and then use the Zoom chat to talk with each other. And if you actually have a question for the speakers or something you want us to raise for the moderator, just put in question ahead of it in the chat so that we know. And there will be a couple of us monitoring that. The lovely Aoife and Paula will be supporting us today. Or you can use the raise hand function, and there's just on the screen here some instructions on how to do that within Zoom if you want to use the raise hand function to say I have a question. So that's all that I wanted to say before we get started, and I'm going to turn it back over to Syexwaliya to get us going today.
There, I have to always remember to unmute myself and say, hello, Namaste. I'm really glad to see you and everyone else. Though Jillian and Terry, I saw you earlier. So I just want to say, Kayachton, I welcome you to this session that we're going to be sharing today. And really grateful to be part of it. And then want to ask that we always remember that we're here to work together and be able to chen stwite, stand and work together to hold each other up. And today's session is cultural safety during a pandemic. And that's really important because I've been on the regional nurses meetings and always needing to know and understand how everyone needs to feel safe and that you're all knowledge keepers in your own right. And so I just ask you to let's have a great session. And let's listen to the presentation and be able to share our different views and even create solutions to build on what we learned today. And so I'm just going to ask us, my grandfather shared that we all pray to a higher power and that we respect each other's ways. So I ask you just to open yourself up. Don't have your arms crossed or like this or this, because my grandfather and elder said you're blocking off the energy from Creator and the ancestors. So I just want to ask you all to come together in a gang for those who were here earlier and say, Chen Quen Mentomi Kakakanak Chesiam, Yonsio so man desquals deceits, Yonsio man squalwen. Snachum Tsetop to squalls deceits, asking you, Creator, to help and watch over all of your children gathered here today and to bring us together within Chomot and Squalwin, one heart and one mind, not Samot and Squalwin and Hamalkamalum. And to Chen Stwite, stand and work together to hold each other up, support one another, help each other, and be able to have a great meeting, Creator, and help all your children gathered here and their family and friends with their squall and mental, emotional, physical, spiritual well-being. And asking you, Creator, to let the meeting be at one halt, say top, and excellent work that goes smoothly with all of us coming together Tamakwasi Snachum Hoichaka, those are my words, and I'm grateful to have started you and look forward to the presentation and sharing. I'll turn it back over to Jillian or Terry.
Thank you
so much, Syexwaliya. Go ahead, Terry.
Oh no, that's okay. I'll bow out now and let you take over. Thanks.
All right, Namaste, over to you.
So good afternoon. Thank you, Syexwaliya, for welcoming us to the territories. As is the protocol, we're mostly based with our host organization, Research Ethics BC, and the Academic Health Sciences Network here in Greater Vancouver. And I just want to express my deep appreciation to Syexwaliya, who is a wonderful, knowledgeable leader and a dear friend, and I really appreciate her time today and to ground us in a good way. So I'll introduce myself. My name is Namaste Marsden, and my traditional name from the House of Gamlachielt is Messamtalk. I'm from Gitnyaw in northern BC, and I'm Director of Health Economics and Analytics with the First Nations Health Authority, and also a member of the advisory committee with Research Ethics BC. And I'm really thrilled today with our panelists who are joining us. Syexwaliya, who you've already heard from and you will hear from at the end to close us off in a good way. Well, we're going to hear first from Angie Bain. I'm gonna really do my best to pronounce properly, but please correct me when you start. Inkla Katma, researcher with Union of BC Indian Chiefs and a member of the Research Ethics BC Advisory Committee. We're then going to hear from Julie Morrison, who's a manager of health emergency management for the Northern Region of First Nations Health Authority from the House of Squamish, please correct me, Gitxsan Nation, and her traditional name is Gusager. And then our closing panelist today will be Tribal Chief Tyrone McNeil, who is Stolo and a member of the Seabird Island Band. Lots of achievements that I can speak to a little bit later when I introduce them. So very happy for this distinguished panel, and I think I'm speaking for all of us when I say that we're very excited to hear their perspectives on the topic of cultural safety for First Nations, Indigenous people and communities during this pandemic. So without any further background, I'll just ask Angie maybe to bring her screen up, and she's got a presentation to share. And then just a quick reminder to please hold your questions towards the end, and we'll have some time. And if you would like to put them in the chat, if you're afraid of losing them as you're listening, feel free to put them in the chat, and then we will answer them at the end.
Thanks, Namaste. Before I bring my screen up, I just wanted to say, for those who are brave enough to quickly turn on your camera for just a couple of minutes so we can see all your beautiful faces, I just wanted to say hello. I'm camera shy myself, so I don't like to keep it on. Just let us see you for a couple seconds, and I'm really glad you're here to join us today. Thanks. All right, so I'm going to do my best to share my screen now. Let's see. How does it look, Namaste? Have I got the slide up?
It looks great.
Okay, well, I didn't share myself my speaker's notes, so luckily I have a printout here next to me. You might hear some paper turning, I apologize. I'm really happy to have this opportunity today to help set up our panel. The topic of cultural safety during the pandemic is definitely a timely issue. And I wanted to start us off with a project that the Union of BC Indian Chiefs did recently. We represent, for those of you who don't know anything about UBCIC, we represent about 30% of the province's First Nations. And we really represent those who are primarily outside of the treaty process. So we're a nonprofit advocacy organization that's been around since 1969. And as Namaste said, I work in the research department. So this project isn't something that I did, but I have the pleasure of reporting on it. So I wanted to acknowledge Mary Elise Laforette, who did the bulk of the work with the engagement and writing of our report that accompanied this. So wanted to start us off there. So the hope that I have for you today is that you will see with this topic of safety during the pandemic, this will share a little bit about why it's important to communities that we think about this. So I'll just get started. Okay. My slide is not advancing. Hang on one moment. I'm going to stop the share. Share again. And we'll do this. Okay. That still look good from your perspective, Namaste? All right. So what we did was we did a month-long data gathering project, and Mary Elise called all of the UBCIC member communities to see what kind of supports and advocacy they needed during this COVID-19 pandemic. And they were very forthcoming. We didn't get responses from everybody, but we did get a fairly healthy response to a questionnaire that we had. And we had a number of follow-up sessions that we did. So we just presented this quite recently at the UBCIC Annual General Assembly with our chiefs, and got some more feedback from that. So the goal of the project was really to support our communities during this difficult time. And what we got out of the questionnaire were 13 priority concerns that I'll summarize, and 6 very specific recommendations that they had where they could use support and had some concerns. So you'll see on this slide, I've summarized the concerns over a number of slides, so I'll just speak to the ones on the slide here. But some of our concerns were around health services, Indigenous community, the Indigenous Community Support Fund, community isolation and jurisdictional issues, and food security and access to essential goods. So our communities told us, although there's some supplies in the communities already, it's just not sufficient. And access to things like PPE and sanitation supplies are challenging. So when we think about research projects going into communities at times like this, we really need to think about the practical things like, do communities have the supplies they even need internally to deal with the pandemic, let alone bringing outside people, academics or others into community. There was challenges with testing. I won't go over all of them, but just to highlight some of the main concerns were with some of our rural communities. Rural communities, particularly at the start of the epidemic, had some challenges with the typical transportation networks and supply networks were disrupted. So for some of these communities, they only get this health services when people fly in or come in by boat. And that was before the pandemic was on a predictable schedule. We had a period in time where that was really disrupted. And although it started back up again, for many of the communities, it's at a reduced level. So, you know, it's very hard to think about research when you're worried about the health care of your community members. And so these are kind of practical concerns that our communities identified that they're dealing with. Some of the things that we can do in Vancouver or in urban centers simply aren't possible in communities. So we have people like Bonnie Henry giving us very practical advice for how to deal with this in terms of, you know, keeping yourself isolated or having some distance between you and others. And it's just not possible in some communities where we have multiple generations living in single family housing. And so it's a real challenge for communities. And I think that's something that as a researcher, I've been thinking about since this started. And full disclosure, I do a lot of work for my own community, which is in Lower Nicola, which is just outside of Merritt. And I haven't been able to be back in my community since February to do any work. So it's all been online and or pushed back or whatever was required. I've gone home to visit my family, but just quick visits outside to gather some medicines and plants. There's a definite lack of funding supports that were a concern for communities. And some of it's not just the amount of funding, but it's the flow of funding. So there's just not enough money to do what communities need to do. Some of the other concerns included helping off-reserve members. So this is a challenge for communities at all times. But during the pandemic, people have been looking to their communities for support. And I don't know if everybody's aware, but there was a role that was set up quite early on for friendship centers, which are typically in the urban centers, to play a role in supporting the off-reserve members. And for communities, that just wasn't working because sometimes people can't access the friendship center, or they were turning to their community for support. So really, times like this, people look to their families and they look to their communities for answers. So community wanted us to know that, and they wanted us to help them help their members, whether they were on or off reserve. As I said, there was some disruption to the transportation and travel issues. Small businesses have been impacted. A big issue for us is technology and connectivity. So we know that a lot of communities, it's just impossible to get online to access some of those really unique things that have been implemented in the province. So for example, the online medical care, where you can just get online with a doctor and ask for some advice. It's just not possible in communities. So that's a challenge for them. Childcare is an issue. So we need the core of our support staff in communities to deal with this pandemic. That includes, chief and council, our governance structure, but it's so much more than that. It includes our administrative people, people who have a role in the food security issues. So quite often we have soup kitchens or lunchtime meal programs or breakfast meal programs for the kids. And those things were interrupted. My own community just this week started up our soup program again. So, that's just a reality of what communities are dealing with. And on top of that, with the childcare issue, we want to keep our elders safe. And so quite often, a lot of our grandparents are helping with childcare in community. And we haven't been able to have our kids in with our grandmas, which is so important for the for the love and support, the connection with grandparents, but also that cultural transmission of knowledge and those feelings of community and identity. All of that's been disrupted by COVID. There's been a reduced staff in our offices. A lot of them are just starting to go back now. So if you've had delays in contacting community, it's because we've been focusing internally on our issues. And really, there's so much information coming through. And this is what the respondents to our survey said. It's just information overload. It's just too much. And so they've had to focus on what's most important to them. And so with reduced staff and not being able to go into offices to access materials, we've had to find kind of creative ways, as most people have had to do, during the pandemic, but just kind of exponentially felt in communities. You have, 3, 4, 5 people trying to work from home, from a kitchen table, when you have all the kids at home also. It's challenging. So I'm hoping that as REBC that we consider these challenges, these very practical challenges that communities have. One thing that hasn't stopped for communities is something called Crown Land referrals. So there's a process anytime anything wants to go through your community, you get a referral submitted for early engagement or consultation. And these things could be for things like the Trans Mountain Pipeline, which is, as most people know, construction is ongoing. So we've got work camps coming into communities and being set up near communities. And I've seen a huge disproportion in, work camp of 300, 400, 500 people even, and a community with 40 or 50 people. So that's a bit of a challenge in terms of how the community can deal with that and keep all of their own COVID measures in place and their own safety measures in place. And then we have our own emergency response plans. So the one of my big concerns is that we listen to what communities are saying they need right now. And a lot of communities have done their own plans, their own COVID plan, their own emergency response plan. Sometimes it's a cultural plan. You know, what do we need to keep us safe? What do we need to do the work we need to do? So the very first thing I recommend always is to see if a community has done that themselves. So in addition to the concerns that they raised, they gave us some recommendations. And the one thing I always say about communities is communities know the answer to community problems. And, you know, we go in thinking that we're solving all of these problems for communities. And that's not always the case. Quite often communities know what needs to be done. It's just a matter of needing that support, of needing help, of maybe, you know, determining priorities, what comes first, the health of your community or that research project that could be done 2 years from now. So those are kind of things that community has to deal with. But what they asked of UBCIC and I guess others, and I think there's a role for REBC in this, is to do some advocacy work on their behalf. They need to know when there's COVID-19 infections in community. And the way it's set up right now, we heard that the communication is not working well. So there's the health authority, there's the doctor, there's the district involved, and then it gets down to chief and council. So it feels like there's too much of a delay and too much of siloing of these communication strategies. What communities have asked is, let us know now. So whatever we can do to make sure that they're aware of any sort of challenges in community. As I said, information overload is a challenge, but at the same time, they do want to be kept informed. So I always leave that decision to community. I try not to be a bother with too much information, but I let them decide what they need to engage on. So I just pass along any information that I think is relevant and they can decide what to do with it. Then they asked for some advocacy in terms of funding. The Indigenous Community Support Fund was insufficient for a lot of communities. The Economic Restart Plan that the province has, you know, there's some good things in it, but communities have already said it's not going to go far enough to meet their needs and challenges. There's a need for support for real practical things for health services, like increased testing and shoring up that distribution network, making sure that things aren't stockpiled someplace, but they're getting out and into the homes of community members. And then that food security, you know, it's not a one-time thing to have to support your community with this type of support. You can't give a hamper once and expect that's good for a year or two. Communities need ongoing support. As I said, there's concerns about off-reserve membership. The delivery of emergency support services is a concern. So they asked for really practical things like checklists. They needed some help enforcing these kind of community safety measures that they've put in place. So one of the things is this isolation. So at different periods in time, depending on what's going on in the community, they'll either be isolated because of COVID being in the community or because the fear of outside COVID pressures in the nearby municipalities or other communities coming into theirs. And so they've done sort of creative things like using their land guardian program, having the guardians do information blockades or information booths. They've had to bring in security guards to help enforce. They've had to put up signage, you know, this is our territory, we ask you not to come in at this time. Some of them have put up physical barriers, and they ban those barriers. And it's not really to, you know, to close the doors entirely, but it's to have some control over what's happening in your community. And then there's those big picture things that are still going on and are never going away. So in addition to those ground land referral issues that I talked about, you know, development is still happening around the province. There's concern for the bigger picture things like title and rights. So the places that matter to us in the city, like the ability to go to your local park, to bring your kids outside, those things really matter to community too. So there's been an ask for some advocacy around the reopening of public parks, and really the educational side of it, sharing information with the public. What does it mean to be in Tlakatma? What does it mean to be in Tlakatma from Lower Nicola during a time like COVID? And how can outside people understand what it means to be from community at this time? And we've seen in the news, I'm sure we've all seen it, you know, for some time, but this issue of racial discrimination in the healthcare system is really at the forefront of people's minds right now. A couple of other requests and recommendations was for some support around administrative and services. So it's around governmental supports, emergency response, interconnectivity. So we know that, and we've have a history of communities helping each other. This is what we did in the past with past pandemics. This is what we want to do today, to learn from each other, to share where we can, to advocate for each other, and to be each other's voice in that way that each of us can uniquely be that voice. They've asked for some supports with some really unique projects going on in communities. So as I said, communities have their own answers to these challenges. And some of the things we've seen are people going out and harvesting quite heavily this year, traditional medicines, and reteaching the skills and teaching the younger generations our medicines and how they can help us through this pandemic, and advocating on behalf of our communities, especially the small communities. They really need our support at this time. And that's what our survey respondents really told us. You know, we're just a small community and we feel like we're not heard. We feel like we're overlooked, and we need your voice. Then there's ongoing advocacy work on the social justice, environmental issues, sustainable development, renewable energy, and the territorial jurisdiction. And I think I just kind of want to close with some comments on jurisdiction. So we live in a world with UNDRIP and DRIPA and TRC report, and we're trying to move forward with reconciliation. And REBC, I've seen over the years, is really embraced these concepts and tried to find a way to bring it into the work that we do. Research projects, and these research projects are really critical and necessary to be continuing in our communities. But at this time, they're another ask. They're asking our community for their time. They're asking our communities for their support, and they're asking our communities for some kind of COVID-safe level of participation. I think REBC has a role to play in this. We know the importance of doing things the right way. We know that we must acknowledge the history of past pandemics and the impacts that it's had on communities. So in my community, we still remember back in 1918 when the flu epidemic came through, the stockpiling of body bags and mass burial sites. Our elders remember the pain of losing grandparents and parents and family and friends. And really the point I'm trying to make is communities are experiencing COVID-19 in an entirely different way than the rest of our societies. We know that there's a lot of demands on communities. And when we ask them to attend to research projects at a time like this, at a time when they're worried about keeping their elders safe and their families fed, and they're struggling to deal with uncertain employment, we're asking a lot. Some of these projects are critical and they will help shape our way forward, but we do need to keep this in the back of our mind. What are communities dealing with? How can we lessen that burden, and how can we help? We need to move forward in a trauma-informed way, and I think now more than ever, that's important. We need to be respectful of community priorities and community processes, and these are new processes in place. As I said, I haven't been to my community since February. We've had deaths, we've had births, we've had marriages. I haven't been back for those because I can't go back for those. And a lot of people can't go back for those. And that's really challenging for us right now. We have to consider the role that REB plays in educating people about this and educating the research field on the right way forward for us right now. This is our new reality, COVID-19. This is our new world. I think that communities need that support that REBC and places like UBCIC can offer. And it will help this work continue while keeping communities safe. But above all, we must recognize and respect that jurisdiction. We need to build and improve those relationships and help move forward on those big things like DRIPA and UNDRIP reconciliation. Moving forward, as we consider engagement with the communities, I hope we consider this issue and help others understand the impact that COVID has had on our communities and play a really positive role in advancing research in communities while acknowledging these difficult times. So, stay up, thank you. I will stop sharing my screen now.
Okay, so it's Namaste, and I just wanted to thank Angie for that really fulsome presentation. We do have time to take some questions, so I'm just going to check in with Terry on the process here, if we can go from the chat or if we have another way that's a little more direct.
We haven't had any actual questions put into the chat right now. We've just had some people saying thank you. So if people want to ask questions, they can just, unmute themselves and speak up.
I think I'll just add that we haven't released our report publicly at this time. We presented it to our chiefs in assembly, and we have a slightly redacted version that we can share. It just had some very specific information that we couldn't just throw it up on the website and share. But if anybody's really interested, please do get in touch, and I can find a way to get you a copy of the more redacted report.
Mm-hmm.
I was wondering why it is you can't go back to your community if you were to isolate in your community for 2 weeks. Why could you still not go back?
Yeah, it's partly a practical thing and partly a respect thing for me. It's I live in Burnaby, so going back home is a 2.5-hour drive. So usually I would go home for a couple of days and for whatever I'm up for and come back. So it doesn't, I just can't do that isolation. Either before and after. I've got a son in school, and my husband works for the province, so he's out there, out and about, especially right now with this election work. And so it's very hard for us to isolate before going to community. And then the people I work with have a lot of their own concerns. They have to look out for their families and their elders. And so they don't want to meet at this time if we can help it. And so a lot of our work is just like this on Zoom. Yeah, but with some of the some of the important cultural events or life events. We've had funerals and people have tried to go back. We've had some COVID scares as a result. And so I guess it's a choice. I choose not to contribute to that.
Mm-hmm. Thank you.
Sorry, I didn't fully explain UNDRIP and DRIPA. So that DRIPA is the provincial adaptation of UNDRIP, and UNDRIP is the United Nations Declaration on the Rights of Indigenous Peoples. And so one of the things that we're seeing, particularly at UBCIC, is this this acceptance of these international instruments to protect Indigenous and Aboriginal rights, this recognition of the importance of things like language and culture in communities. And so these two pieces of legislation, well, DRIPA, which is an instrument, and, or sorry, DRIPA, which is the provincial act acknowledging and accepting UNDRIP, gives us a tool to better recontextualize our relationship between First Nations communities and the rest of the province. And it kind of shows us, you know, a way forward that includes Indigenous laws, includes Indigenous values and protocols and principles. So that's a really kind of quick and concise way to explain why it's important, I guess. Namaste will have much more to say on that.
Great, thank you, Angie. So we do have one question from the chat and one waiting with their hand up. So we'll just go to the first one from the chat. So this is from Catherine. She says, I'm curious as to what the response from communities has been towards research involving the use of technology. So for example, Zoom, like we're using today, or online surveys.
Yeah, Catherine, I haven't done a lot. My research is different, I think, from the typical research ethics BC would do. My research is most often around cultural heritage and land claims research. But what I've noticed is there's been a lot of Zoom calls, GoTo calls, Blue Jeans, Microsoft Teams, even some Facebook kind of meetups. And that at the start, there was a lot of enthusiasm for that, and it's really waning. You know, we have people who get on these kind of calls like today who've just spent a whole day doing this, and they're getting tired. So I think that although there's some tools out there that we're using, and surprisingly, one of the projects I work on is a project that's with the province and 5 First Nations around water governance. And a core part of the project is engagement with community members to pull up the laws and the traditional knowledge and the values. And wouldn't you know it, but COVID came just as we were trying to get into the communities to do that engagement piece. So we've had to try to find very creative ways to get in and work with our communities. At the start, because the situation is very different in the interior versus, you know, here in Vancouver, people were more comfortable with some COVID measures in place and meeting face to face. So people would meet 6 feet apart and things like that, or go outside and sit at a table and still meet. And as things got worse over time, we had less and less of those, and now they're not really happening that way anymore. And then we had community meetings where we would have a smaller Zoom call, so not so many people on, a little bit more manageable. But we would still meet with the language speakers, because language is a big component of that project. And it worked well for a little while, but then, as I said, fatigue kind of set in. So I don't know if technology is the answer. It's certainly a tool, but it's, you know, we're using it as best we can.
Great, thank you. So I've got 2 more questions, and then we'll see if we can squeeze in one more if another one comes up, but I think we'll go to Marilyn next, and then Rachel Scarth, and I'll read that out. And I think Aoife is going to help us connect with Marilyn, or Marilyn, if you want to go ahead and speak up.
Thanks very much. First of all, Angie, it's very thoughtful presentation. Thank you for that. Some of my observances, really more than the question, first of all, is how similar the needs that were identified with regards to the presentations this morning. For instance, food security, domestic violence, you know, that isolation. What I'm specifically looking at is the community support, and you have talked on this, but it's more, I am a patient partner with the Interior Health support group for patient engagement and research. And I recently, when Bonnie said we could travel in the province, did go north to Prince George from Kelowna. And on my way, I got lost and took a side journey and ended up about halfway to Bella Coola. And I started to see signs that were indicating where I actually was. But what was interesting for me is after already a 2-hour travel, I had no cell service. I had no access to anything. And that further exacerbates that isolation. Can you speak to that specifically, please?
Yeah, for sure. That's a real challenge. I did a lot of work up in northern BC, and I know how, even with the best of times, how hard it is to access, first of all, the communities, and also you know, access to resources. And a lot of people during times like this, they want to do a lot to keep their community safe, so we don't go shopping in town as much anymore. And you know, we might only get gas every 2 weeks if we can help it, and things like that. And so being an outsider going into that, it's really challenging because you still need to rely on those kind of services and supports. My sister works with a lot of the northern communities in BC, and she just recently started traveling herself. So she was not traveling during the first wave of COVID. And I asked her how different it is for her right now. And she said, surprisingly, yeah, it's different, like how you would expect it to be different. But surprisingly, she was able to do all of the things that she needed to do along the way, you know, stopping and picking up snacks and just gassing up and having a place to stay. And there's broader things happening in the communities, which are good things. So she talked about staying at hotels and how hotels are doing all this work around COVID to keep travelers safe. She had the same room when she went up 2 weeks, every 2 weeks to the same community. She always was given the same room, and they put in additional measures to keep her safe on her way up. And then when she gets to the community, she said it's amazing. Like she felt very safe when she got to community. There's all of the plexiglass, the washing of hands, the very strict rules for everybody has their own table when they're in a meeting room together. Nobody's more than 6-10 feet up close to each other, so they have to have distance. There's rules about using facilities. So that I think that there's we're all trying the best we can to do with what we can. It comes down, as Dr. Bonnie Henry says, it comes down to what we each individually do. And so I know it's a challenge, but people are doing it. I haven't done much of it myself yet, but I'm learning from what everybody else is doing. I don't think that answers you very well, but that's just a kind of some observation that I've had.
Great, thank you. So we have 3 up here, and I think what I'm going to do is I'm going to read out the question from Rachel, and then we do have some time after Julie's presentation, and then maybe we can open it up. And then if if Julie or Angie want to address the additional ones that we can't get to right now, at that point, we'll go over those again. So I'll just go to Rachel's. So she says, thank you, Angie, for the clear articulation of why communities may not be able to engage in research. How can we best communicate this information to our university researchers?
Yeah, I think for me, the best thing we can do is educate. And so, you know, if you poke around a little bit, you can find things like community protocols that, you know, and community preferences. So a lot of people are using social media. For example, Facebook is still very much alive in communities, maybe not so much in mainstream society, but if it's not on Facebook in my community, it's not official. So, you know, you can use those kind of tools to see what communities are saying about how they want to engage at this time. And you really have, the onus is on us to stay on top of that because it's ever changing. You know, when it's safe one week, it may change the next week. Things open up and they close down and they open up again. And so the best I think that we can do is help point people in the right direction. So remind them that things like Facebook are still relevant in communities. Remind them to check out community web pages and Twitter and things like that. And also to look to places like REBC, UBCIC, First Nations Summit, BCAFN. All of these advocacy groups are doing a lot of this work. So we don't all have to do it all. Just making those connections and educating people on those resources, I think would be a huge step.
Great, thank you. So I just want to thank Angie again for sharing with us today, and certainly hope you stand by because we have more questions and it would be great to hear your responses on those when we get into the general discussion a bit later. So
thanks.
Yeah.
I seen the comment that somebody wanted the report, so I will follow up. Thank you very much.
Okay, so I just wanted to let people know that I do have notifications for a question later from G. Gottfriedson, Frederick, and Eugenie. And so we're just going to park those for now. And I do want to extend a really warm welcome to Julie Morrison. So as I mentioned earlier, she's the Manager of Health Emergency Management for the Northern Region of the First Nations Health Authority, working with 55 communities, obviously in various levels of distance from centers and services, and I'm sure she'll share her knowledge about that. And she has a lot of experience around crisis management and also emergency response. And so, and also does work as a patient partner and a lot of advocacy. So thank you so much, Julie, for taking the time to be with us. And I'll just turn myself off so you can get started.
Well, thank you, Namaste, and thank you to Syexwaliya for the welcome. And I also like to thank the Research Ethics of BC for inviting me and letting me speak today on cultural safety. As Namaste had said earlier, that I'm Gitxsan. I'm calling in, or I'm coming to you live from our Gitxsan Nation in Gittimax, BC, which is near Hazelton. And I'm from the House of Goyt and is part of the Wolf Clan, and my Gitxsan name is Kusagetru. And you know, I feel really blessed to be able to do the work that I do for First Nations Health Authority. I was a health director for 6 years, so I got to learn about the programs and services that are offered through First Nations Health and previously through Health Canada. So I got to learn a little bit about it and also worked with the suicide prevention and postvention program. It's called FAST, which is First Nations Action Support Team. It was a concept that was built out of our community based on a rash of suicide attempts and deaths by suicide. And so this was a community solution to try and address the problem. So I was really lucky to be involved with that program. continue to do that work for First Nations Health Authority. And it's through my job, I've been able to do a few different things, like throughout the year, 3 or 4 years almost now that I've been with FNHA, I've been able to assist our communities through the fires of 2017 and 2018. And now the pandemic is the most important work that we're doing in the FNHA for our communities, working with them side by side. So when we're looking at cultural safety during a pandemic, we want to make sure we're creating safe spaces in and through our meetings to ensure that we and our partners hear our First Nations communities during the pandemic. We want to hear them. We want to listen to their concerns from their point of view in cultural ways of knowing through their protocols and traditions. And when I started my role in working with 55 communities, I knew that I had a lot to learn about the cultures and traditions and protocols of our other communities. I know our Gitsan ways, but I needed to learn a lot about our fellow nations. And so when I approach a community, I make sure that I listen and I take the lead from them so that they can let me know how I can best work with them. They know their communities best. They know what's going to work, and they know how the community is going to respond. So we want to follow them. And we know that every community has people that are natural leaders. There's the elected leaders. There's also those natural helpers that stand up in times of need and reach out and do the work that's needed to be done. So with our crisis response in FNHA, we never want to interfere with that process because that's been there since the beginning of time. And we want to make sure that stays in place and that we don't overstep that, and we want to respect that. So when we're looking at trying to create a culturally safe space, we want to make sure that we're doing good partnerships. We're working and sharing of knowledge with community members that are the experts, that we may come in with a plan, but understand that it's only a template and that their input is needed. And if they feel there's a modification that needs to be done, we would do that with their input. We want to take a look at our personal knowledge, because we need to acknowledge that we each come with our own understandings based on our life experience, but that may be very different from the people you're working with. So we want to make sure that we check that whenever we work with any community. And when we look at the protocols within each community, they have their ways of knowing, their ways of doing things. And it's really important to be able to ask and listen to the community leads. And then we want to look at the process. We want to ensure that there's equity and dignity for all. And that's a really important, well, all of them are important, but it's so important to make sure that we are treating our people with dignity and respect and honor in everything that we do, because it's all about them. That's why we are here. That's why we have our jobs, is to provide that support for our communities. We want to have a positive purpose. And by that, I mean, we need to focus on our strengths and ensure confidentiality and accountability, because we want to make it matter. We want them to know, that the community members to know that their concerns are valid, that they do matter. You know, we do lose so many people in our communities to suicide. And, you know, it always feels like it's something that had we known, and we could have maybe prevented and worked towards finding ways to support the person in a different way, that we missed that opportunity. So we worked really hard towards doing that. And I think there's a lot of issues at hand when you look at the residential schools, you look at the racism, which is alive and well, and we know that, and we see it, we hear it, and it's really prevalent now in the news when you watch what's happening back east and the way people are feeling. You know, it's nothing new to us. We've known it, we've lived with it, we've grown up with it. We'd hope that our children wouldn't have to experience that, but I don't think that we'll be able to save our children from that. They do feel it already. I know with our daughters, they're 3 grown women, and they do experience it as well. We can work towards rectifying that by talking with people, by sharing the concerns that do come up. And, you know, like with the potlatches or feasting, we have feasts in our area. And when those were banned, even though they were banned, our people still kept doing them. They would take it underground. They would do it when the Indian agents weren't around, because that's our governance system, and they didn't want that. I'm thankful for our ancestors that they did that, that they kept it going. And the same with this during the pandemic. Our people have found ways to do that same support and same level of care and love and attention for those that we have lost. It's a different way, but it's still being done, and trying to follow the traditions and protocols that have been passed down through us through the millennia. And I just wanted to go over a bit about the history with FNHA and where we are and where we've come from. With FNHA, we're really about building relationships. And so with one of our key partners right now in the northern region is the Northern Health Authority. And we've been working with them, creating different mechanisms for us to be able to participate with Northern Health Authority. So within FNHA, we have the Northern Regional Table, which is a space for Northern Health Authority, First Nations Health Authority, and First Nations Health Council reps to attend. And they sit at this table where there's, and they talk about how health is delivered in our northern region, in our hospitals with the doctors and the nurses, and how we can try and advocate so that our people can be seen and be heard. One of the things that has always been talked about and stressed year after year after year is the fact that our people, when somebody is in the hospital or like in the end of their life, we know they're going to pass away, or when a baby's being born, our people like to be there. We need to be there. And there's no other place we'd want to be but there. So we've been working with Northern Health to make sure that they understand that. And Northern Health is working with us as partners, and they hear what we say, and they're trying to make changes. And we really appreciate that. And we know there's a long ways to go yet, but we are working towards that. We also work with EMBC, Emergency Management BC, Health Emergency Management BC, and Indigenous Services Canada. And we've worked with these entities within the fires of 2017 and 2018, and now with the pandemic. And this has been part of our emergency management development that FNHA has been working on, creating policies and procedures and positions to make sure that we're able to provide this support to our communities. And didn't expect the sun to creep out today. All of a sudden, my face is in the sunlight. So with the Northern Health and FNHA, when the pandemic started in January, they started having meetings, and then we were invited to participate and hear about the plans that were in place to make sure that if and when COVID hit our communities, that they would have the services in place. So FNHA was invited to participate in their meetings. And along the way, they decided to create a rural and remote framework, which is meant to be a guide for Northern Health and FNHA to lay out a path so that if and when COVID hit one of our communities, everyone would know in place. And the goal within this plan was to support our Northern First Nations communities in addressing COVID by creating specific tools and processes for our community health service delivery and professional organizations. And how are we working? We want to do it in a culturally safe manner by respecting and protecting First Nations decision-making and control. We want to embody FNHA directives and its leadership statement. We want to provide the necessary information for timely decision-making by First Nations leaders and communities. So when we're in these meetings with our communities around COVID, we give them all the information, we give them all the tools, and we wait for their input. And if changes need to be made, we can do that for them. And we want to make sure that we're wrapping around the whole community and the support staff. We know that it's very challenging for our smaller communities to be able to provide this care with limited staff. And through the collaborative goals of Northern Health and FNHA's working group, we wanted to ensure the safety of all our First Nations individuals in the communities. We want to provide care for people to be able to stay safely in their communities. So we have isolation plans in place for each of the communities should COVID hit their communities. And we want to make sure that we're providing appropriate supports and culturally safe care for anyone who has symptoms of COVID-19 or somebody with underlying health conditions, people who are relocating from their communities for health services, or individuals returning to home from the community. And since the beginning of the pandemic, First Nations Health Authority has created, modified, and revisited many of our policies and plans so that we're able to provide the support in a way that's meaningful to our communities. And with FNHA, one of our directives is that we are nation-based and community-driven. So we want to hear our communities. We want to make sure that it's their voices that we hear. They guide us, and they let us know how we can support them. So just a little note about what happens in one of our communities if there was a case of COVID. And I'm really happy to say that in our northern communities, we do have, like I think I might have mentioned, we have 55 in the northern region. We have had cases of COVID and our communities have worked really hard and managed to contain the spread total, and the majority of our community members have recovered that have had cases. And when a case happens in a community, these are the things that we do. And I know that Angie had mentioned something about the confidentiality or the information pathway for cases. We heard that from our communities right in the beginning of the pandemic. They wanted to know when the cases were in their community, where the cases were, and that wasn't able to be shared widely because of confidentiality, that people that receive tests, that they are entitled to have that information kept confidential. But hearing that message loud and clear from our communities and our leadership, there was work done between Northern Health and FNHA. Our regional executive director, Nicole Cross, will now be notified that if there is a case in one of our communities, one of our First Nations communities. She won't be given a name, but she will be given that there is a case in this community, and she can reach out and connect with the health lead or the political lead and just to let them know that there is a case in the community. There won't be any names mentioned, but it's just so that they know that there is a case and that we will be working with them to provide that support. So if there were a case in the community, we would meet with a community health lead. These meetings are set up most often through teleconference lines. We'd meet with the community health lead and political health lead, sometimes the emergency operations center leads. And the community representation is really based on who they feel they would like to have attend the meeting. And we listen to the medical health officer for Northern Health, the medical health officer. We have a few of them that we work with and they attend based on the region. They give us an update on the number of active cases, the total number of cases. So they may have one case that's active and they may have like 18 people that have recovered successfully from COVID. So they give us the total number that have tested positive in that community. They'll tell us how many people that they're doing contact tracing with. And they'll work with the physicians within community to make sure that they're aware of who's being contact traced, and they will offer them supports by phoning in daily to monitor how they're feeling, and should things change, they would get them closer to a hospital. And through that rural and remote framework that was developed. They've identified 3 hospitals in northern BC that would be able to provide that support at a higher level of care, and that's in Port St. John, Prince George, and Terrace. And if somebody in one of our remote communities, because right in that, while the rural and remote framework was being built, we took a look at all of our communities to see how far away are they from a hospital, what challenges do they face in getting to medical care. And if the communities are further away from a hospital, we would bring them close to one of the 3 hospitals, and we could put them in a motel or a hotel, and we would provide them with accommodation and meals and transportation so that they're closer to that higher level of care should they need it. And we'd also assist with isolation in the community. If the person tested positive and was well enough to stay home, we would assist with isolation in community. The community would provide food, whether it be meals or groceries, and we would reimburse them for that so that the people can stay at home and be comfortable. And for the most part, the community members would prefer to stay in their home community. But if they're not able to stay in their home because somebody's living in their home that's immunocompromised, we could put either the person that's immunocompromised in the hotel or motel, or the person that's needing to isolate. So we do take that into consideration, and if we do have to put them in a motel or hotel, we would put them, we would cover all those expenses as well. We like to, when we do have these meetings, we listen to the health lead or health lead and or nursing staff about the challenges they're facing. We want to know how we can assist them with any type of communication issues they may be having. If communication issues, I mean documents. So if they need a document, we have a resource library full of documents that have been created since the beginning of the pandemic. We can provide them with that, and then we can access either our regional staff writer or a provincial FNHA team member that can assist with modifying that document to make it suit their needs. We can look at their staffing. If they're going to be short-staffed due to COVID and say somebody was sick within their staff and they needed a replacement, we could do that. Quite often we've had situations where the nursing staff are quite exhausted after providing ongoing support for 2 weeks straight or 3 weeks, and so we can supplement their staffing. We also work with their communities to make sure that they do have the PPE, the personal protective equipment. And then we also have a community services COVID supplies, which is for people that are not directly involved in the health. It's non-medical health grade. We do have our environmental health team who are able to provide supports as well. They could work with the community if they have any questions around making sure their buildings are safe for business continuity. So we have our regional team and provincial team on in every department within FNHA. In our northern region, we have our regional leads and staff, but we also can reach into the provincial. And then we look at our mental health supports. The challenge with COVID is that people are not able to travel. People weren't able to have mental health support because of the distancing. So we've provided most of our communities with Zoom for the workers that are able to connect with their community members through that. We know that a lot of communities have faced a lot of issues around addiction, especially when they have their security checkpoints in place, that people are feeling like they are trapped and they may not be able to go and get their whatever it is they need to help them cope with the stresses that they may be feeling. So we do have support staff that are available to guide the communities and give them any advice or what's worked in another community. Traditional wellness, and we've been working a lot with traditional wellness in all of our gatherings at FNHA, and we're trying to encourage everyone to try it. I think it's a great supplement to your health care, that you can see a doctor, you could see a mental health counselor, but you can add in traditional wellness. I strongly recommend it. just so that you can, they can pick up on things you'd have no idea that you were even carrying around with you, and your energy gets blocked. And so they help to release that energy. And so if communities are having a tough time with COVID and isolation, then we can work with them to make sure they get the traditional wellness that they need. And a lot of our wellness providers have modified their delivery to be able to do it over the phone. And when we have a positive case in any community, we have our communicable disease team, and they're able to give guidance as well about how to minimize transmission, to try and contain it. And I'm really proud of our communities because they have done a really good job of containing the virus when it has been in our communities. The testing, when communities have been asking for testing, they want testing in their communities and closer to their communities, and FNHA has been working with Northern Health and the province to get testing brought closer to the home community. I know with one of our communities, when they did have a positive case, they brought forward concerns about the testing site being so visible to people driving by. And a lot of our people live with a stigma, and it is, it's kind of something that's been dormant, just like viruses. It's been dormant, but with the pandemic, it's sort of come to light. So when our First Nations people have or live near a virus, somebody who's got COVID, we all get painted with the same brush. Everybody looks at us like we're carrying the virus. And I could be walking beside somebody who's non-native, and they might well have the virus. We don't know. We don't know who has it, and we should treat everyone like it is around us. But it was really evident with one of my neighboring communities when they had a case and going into one of our bigger centers and having the way people looked at us, they looked at us differently, and they themselves weren't even wearing masks. And if we wear masks, then they just look at us funny. But as part of talked about it earlier, the racism and the stigma, it's really prevalent. We also work around the isolation supports I was saying earlier, where they can stay in the home or they can stay in a motel or hotel. Our goal for the isolation is to keep individuals comfortable while they're isolating, where they are comfortable, which for the most part is at home, where they can eat the foods they're accustomed to and feel comfortable. We want to listen, we want to learn, and we don't want to assume. With one of our communities that had a positive case, we had put somebody in a motel, and the motel phoned and left some really rude comments on the health center's voicemail. Not only once, but 3 times. And when it was brought forward, my automatic response was, let's just not use that place anymore. And I had to think about that a little bit more. And I think because I'm a First Nations person, you can see quite easily that I've experienced that myself. And I know that this probably wasn't the first time, and it's not going to be the last time with this motel. And so my gut response was just, let's not use them anymore. Why are we going to put our people into a situation like that when they're already stressed enough as it is with the pandemic? But the health director wanted me to talk with the motel to try and see if I could take this opportunity to educate this person a little bit more. But the man I talked with, he wasn't interested in any of the documents that we had available to help any motel or hotel in making sure that they clean the room in a good way, that they're keeping their staff and clients safe. All he wanted to know was about this person that we had staying there. And I explained to him that I was not at liberty to share information about this person, and that he should treat every person in that motel that came. I said, you don't know when people come from another town, whether or not they've been in contact with anyone, but that didn't matter. And so in the end, I did recommend that we take that motel off of our list of places to put people in to isolate. Just because it, you know, like, why are we going to pay somebody to take our people and treat them that way? You know, we've been living with that for far too long, and we just can't keep tolerating it anymore. You know, I'm really appreciative of how far we've come with our work around cultural safety, cultural humility, and the good work that's happening in a lot of our healthcare systems, and recognizing that we do have our ways of doing things, and that when you sit and talk with people, you can learn about them and you can make modifications to how things are done. And I understand there's a lot of stress in some work environments, but I don't think that's a reason to treat people badly. That you know, when I work with people, I really like to listen to them. I like to learn about their ways because, like I said, with our neighboring nations, I have a lot to learn about how they do things, and I try to listen. And when just looking at my notes, finally, making sure I'm not missing anything. So one other thing with the pandemic is when it's in the media, and today, just being on a call today, because there's a case in one community, and this isn't the first time, that when employers find out there's a case in one of our communities, they start to tell their employees they're not welcome to come to work. And, you know, they wouldn't do that if you were from Smithers, and they don't know how many people have tested positive in Smithers, but they would never say, oh, sorry, you're from Smithers and there's 3 positive cases there, so you can't come to work today. You know, but they're doing that to our First Nations people. And so that is really disheartening. But I know that all of you that are on this call today are here because you want to learn more about how to treat people properly, how to treat people during research, which is huge. You know, I'm with a research project, the Long QT research project that's been happening in the Gitxsan Nation. It started in 2003. And even now, we're still getting updates from Dr. Arbour. She still comes and gives us updates, lets us know where we're going next with the research, and that we've always been told right from the beginning that we have say in where we go and what happens with the testing. And she'll meet with us, she'll explain it to us, and, you know, because of that relationship we've built with her, I have total faith and trust in what she's going to do and say, because she hasn't let us down in the 17 years that we've been working with her. So I really, you know, like, I know there is a really good place for research that we do need to know. We do need to have research done in different ways, and we can learn so much from that. But it always comes back to ownership, and building a relationship is so key. And earlier, Angie, industry, and when we've had cases within industry in the northern region, we've had meetings with the neighboring communities and included the industry that had the case, so that they have an opportunity to share what policies they have in place, what protocols they have in place, and how their plans are to keep their people safe. And if people have any concerns, they should check out the web pages of the industry, like at Site C or Red Chris or any of those mines, because we do have quite a few in the northern region, that most of them do have that information on how they're doing, what they're doing about COVID. And I did talk about the case information pathway. And with COVID supports, Angie, if any of those communities want to reach out to their FNHA regional health manager, because we have one in every region now. It's a brand new position. I just moved into this position on Monday. And there are COVID supports for all of our First Nations communities. There's guidelines. There's a document that outlines all the different things that we support and that we can assist with, and then creating the isolation spaces. So I would encourage anyone that you connected with through your research to connect to First Nations Health Authority staff in the interior or whichever region. We have 5 regions in the north, in the province. And lastly, I just want to say, earlier today, my dad has a totem pole that has been on display at the University of BC. It was right near the Museum of Anthropology, and it was a pole that he and my brothers carved, and it has a running wolf on the top. And UBC called my brother the other day and said that the pole was showing signs of maybe some rotting at the base, and so it was tilting or leaning, and that they planned to take it down. So today they set up a Zoom for us so that we could watch as a family as they took my dad's pole. And I thought, you know what, it's not just a job to them, it's a passion. And I could really feel that today, even though it was a really hard day emotionally to watch. But, they renewed my faith in people that, they could have just taken it down. They didn't have to connect with us, but that's part of where we're going with all the training around cultural sensitivity, cultural safety, cultural humility, and just respecting people, treating people the way we want to be treated, right? So, I just thought I'd share that today, that, we've got a lot of work to do, but we're going in the right direction. And today I'm really thankful for the people at the Museum of Anthropology for reaching out to our family and giving us an opportunity to watch and to know how they were going to treat my dad's pole with so much respect. And so I just thought I'd share that. And when we're doing our work, that we're continually asking for our ancestors to be around us, to guide us. And that, I keep reminding people, our ancestors left us these tools, that they left us tools to get us through whatever challenges we're facing. And that all we have to do is to see, to look back and see, and it's there. I think that's enough for now. Open to questions.
So just on behalf of the participants and our hosts, I just want to also thank Julie for that incredible breadth of sharing. We do have a couple questions queued up from the previous, but is there anyone who would like to say their question, because we don't have one yet in the chat? So just feel free to unmute yourself and then go ahead. We have a lot of gratitude being expressed in the chat, everyone.
Yeah, it was quite an emotional day. When with my dad's art pieces, it's just a connection to him, even though he's been gone for 11 years. To see that today was very touching. But and they couldn't have handled it any better.
Yeah, so beautiful, powerful presentation. And I think, yeah, people are just sitting with it.
Yeah. I know I just blabble on for a bit, but I'll be quiet.
So we'll just leave that for now then. And if you have a question, please go ahead and we'll try and work that in at the end. We have a couple minutes before I welcome Tyrone McNeil to his presentation. So I'm just going to go back to the question from G. Gottfriedson. And sorry, I just have to scroll up here. So the question is, there's a lot of concern from First Nations communities regarding the lack of respect for protocol and ethics when researchers enter into First Nations communities. what recommendations do you have regarding research ethics boards to ensure that First Nations communities and concerns are well represented at REB levels? Angie, do you have any comment to that?
Hi, yes. I think that for me, the biggest thing is communication. There needs to be communication back and forth between research ethics boards and the researchers. We need to really know and understand what is going on with the projects. It's not enough to just have somebody say, yeah, I'm doing a good job, I'm following COVID protocols, and I'm respectful of their processes. I think that now is the time to really make sure we ask those questions. So what are the COVID protocols? Just a few pointed questions to see how well they really understand what the concerns of the community are. I think that's important now more than ever. And I don't know I don't do research ethics board work, so I don't know how to deal with that challenge of that line that everybody would have to deal with. But from a practical perspective, I just say make sure that people are accountable, transparent, and are communicating.
Great, thank you. We had a question from earlier, but I'm wondering, Angie, if it's okay if I ask it to Julie, because it is around cultural safety.
That sounds good to me.
And participant safety. So the question is from Frederick, and I'll just ask Julie. So how is participant safety and harm mitigation being ensured during virtual and remote research? So online surveys, Zoom, especially when sensitive questions are being asked, especially around issues around suicide in residential schools or populations that have specific and sensitive conditions.
So with FNHA, and when we do connect our communities with the Zoom app, it's one of the ones that have safety features put in there so that a professional level of Zoom, the business level. So there are lots of safeguards placed in there so that, and a lot of our communities are open to having people coming into the community if they are using masks, and then depending on the risks that are happening in the nearby area at this point in time. So I know a lot of communities have had counselors going into their communities still, because they realize that sometimes they have to outweigh the risks between the two situations, between people with suicidal ideations or attempts versus the pandemic, and then they weigh out the options and decide which one they need to worry about more at that moment in time. Because we still had quite a few losses to suicide during the pandemic. So we've still had to find ways to get that support in there. I'm not sure if I'm really answering you, Frederick. I don't think so.
I have something to add to that. Not necessarily related to anything I'm working on, but I know that there's First Peoples Cultural Council had a funding opportunity for a special heritage project around COVID, and they were looking for examples of how people dealt with trauma in the past and pandemics in the past and things like that. And one of the things that they asked applicants was how they were going to engage, because it's really about a researcher working with an elder or a community member, and some language component to the project, and how were they going to do that safely. And one of the sort of innovative ways that was recommended was if you weren't living in the same household as the person that you wanted to work very closely with, is there somebody else who's living in that household who you could work with, like hire them to do that call or to help out with the Zoom, or have some role in your project. So maybe some small bit of funding could go towards that support person who could more safely engage with the elder or knowledge keeper and keep you out of their household, but still let you do the work. So I think that there's sort of innovative ways that people are trying to find to do engagement, and I liked that one.
The BC Technology, First Nations Technology Group, they're trying to get ways into our communities as well to make sure that those communities that don't have connectivity, that they can assist with that. So it's another avenue for First Nations communities to work with.
Okay, so I know we have one person with their hand up, but I'm just going to take this last question from previously, and then I'd like to welcome our next speaker, Tribal Chief Tyrone McNeil from the Stolo Nation. So the question came from earlier, and it's from Eugenie Lamb, and it's about Indigenous researchers doing work in their own community. Sorry, I'm just going to scroll up. So Indigenous scholars are researching within and with their own nations and communities. What advice do you have for ethics boards to address these studies during COVID-19 in respectful ways? So Angie, if you want to comment, and then Julie, if you have anything additional.
Sure. Thanks for the question. I think it's a good question. I think that it's important that we recognize the connection that the researcher has to their own community. When I wear my research hat in my community, I'm not just a researcher, I'm also a part of the community. But with me, it's a little different too, because I don't live back home. So one of the things that we do with any project is work with somebody who's right in community. So in that instance where you have a researcher who's a part of community and working on their project, I think it's important that we make space for them at this time in particular, because COVID is a challenge for us all, but we've got somebody there in community, hopefully, there and able to maybe engage a little differently than somebody from outside of community. And that community, my community, for example, wouldn't let a project go ahead if they didn't feel it was the right time. So you can be assured, I think, that community will let you know if it's the right time or the wrong time to do the project. I think in terms of what research ethic boards can do, can just be to support those researchers and understand the challenges that they're going to face in community. Because we all push the best practices for research to be objective and your research to be repeatable and to have some kind of distance from the people that you're researching. And we all know how challenging that is for community members, but I think maybe doubly or triply so with COVID, because if that were me, if I were one of the people who was trying to research in my own community at this time, where I might have given half a day to the person I was interviewing, I would be giving a day or a week or whatever they asked right now, because I would have a role to play beyond just the research project. So I think that we just got to understand and appreciate those complexities.
Thanks, Angie. Just seeing if Julie unmutes.
I was just waiting to see if you were going to just bypass and move on to Tyrone. I wasn't sure. For any type of research to go on in our communities right now, I think it would be best from inside, and maybe looking at trying to find somebody who could work right in the community. We live in Prince George for my work, but with COVID, we've come back to our Kitsan home to isolate here for the past few months, because it feels safer here than it does in Prince George. And so I think with research, if you were to work within the community, they would let you know who is available in the community to do the hands-on work or the groundwork I think that might be an approach to consider, because we're going to be in this for some time. And I know that research grants may not be able to wait until safe time. So that's an option. Thanks.
Great. Okay, so thank you again, Julie and Angie. If we have time at the end, we will certainly open it up for a few more questions. But I do want to thank Tyrone for his patience. We're just a little bit behind, about 5 minutes. And I want to extend a warm welcome on behalf of Research Ethics BC, our host in the Academic Health Sciences Network. So I don't know Tribal Chief Tyrone McNeil personally, but his career is very expansive. He's solo and a member of the Seabird Indian Band, and he's worked in languages, education, runs a successful construction company, and has a lot of experience as well in governance and projects in his nation. So without taking up any more time, thank you, and please join us, Tyrone. I don't see your face yet, but that might be there. Great.
Lau Syexwaliya Kachi Islak Squeetles Gaskaukel Stalos Chilsa Chilsi Sama E Mchlali Ekusa E as Fiatmet de Mammalset, Fiatmet Self-Chromoset. Just thanking everybody for being here, thanking and acknowledging and paying respects to the ladies on the call here. It reminds me back in the day when I set up the founding chair of the First Nations Early Childhood Development Council, where I'd be the only male in a crowd of 200 in a conference talking about early childhood. How do we set up a system? So I became very accustomed to being the minority in a group of really talented, well-experienced, well-spoken ladies. So I always appreciate the work that you do on behalf of our broader community, our children and our families, by being that voice and that representation to look after. In Halkamel and Shafman is look after you. You're looking after us in one way or another. So I haven't been in that venue in quite a while because I've been working in other areas. The Fed stopped funding early childhood in that manner. So although the council still exists, we just haven't been able to advance it. But interesting dialogue here, interesting opportunity to engage on how we might work, we being the collective, work more effectively with First Nations. I really prefer not to use Indigenous or Aboriginal because there's no identity in that. I'm Whonnock, or default to Stalo, default to Coast Salish. And then finally to First Nations, and then maybe to Indigenous, depending who we're talking to. Because quite often when I have been approached a number of times over the years by researchers and asking about us and what it is we do, whether it be languages, fishing, cultural activities, those kind of things. Being in the position I am with First Nations education here in the province, and quite often we're approached in a manner that there's really not a great amount of familiarity with us. They're still in that pan-Aboriginal, pan-Indigenous approach, and don't know how to approach us appropriately. And in that, I think there's a significance in better relating to the identity of the 33 distinct First Nations nations within BC. I get into trouble with some of my leadership. I really don't like calling our Indian bands nations. They're by neighboring community is my cousins and my nieces and nephews. They're not a separate nation. They're a neighboring community that forms part of our tribes and part of our nationhood. And I think it's important that researchers take that into context. Knowing that we'll get some pushback because a lot of folks nowadays do call themselves a nation, even if their community has 130 members, but there's no distinctness amongst them. So when I say 33 nations within a province, that's a distinct language, a distinct culture, distinct spirituality. Some commonness throughout all of us, but there's a high level of distinction as well. And then even within subsets of that. When I say I'm Coast Salish, we quite often refer to ourselves as BC mainland Coast Salish, our 31 communities. 20 communities or so on southern Vancouver Island, but we can't lose sight of the 17 or so communities and tribes in Washington State. Collectively, we are in fact one nation, but just by the political bounds of countries and whatnot, we're separated that way. And due to the Indian Act, we're kind of, in many ways, we lose that sense of nationhood. So when somebody is coming in to do some research that would assist me in reestablishing a sense, or at least a conversation, what is nationhood? What is the tribal affiliations within a nation, whatnot? That tends to catch my attention more than anything else recently, because we do have to find a way to come out from under the Indian Act. But it's in fact that the Indian Act in many ways leads to the ill-informed, inadequately informed, and sometimes even biased folks that approach us for research. And this is writ large. There's nobody standing in front of me when I say that, but I hear that so often throughout the province, because there's some research activities that are just designed to abuse us. Come in to collect minimal information, interpret it a certain way, and then all of a sudden there's a pipeline going through your backyard, or a mine, or a development, or something like that. So when you're talking about that cultural safety, cultural competency, pandemic aside, there needs to be a deeper understanding by researchers, and even if they're our own researchers, of who we are. Because I should share, these are my comments. They're not any of the organizations that I represent, but it's by, I've been doing this for a while, and I see things and I hear things, and people approach me with certain problems and positions, and seek out my advice. And it's a lot of people walk around on eggshells when they're dealing with research and researchers. There's little institutional capacity within our communities, public post-act research type capacity, I mean. Because quite often our elders will be approached and interviewed a certain way, and it may be that interview leads to a paper or a thesis, and there's no real benefit by the elder. The student absolutely benefits, they get excellent marks and remarks, and they move on. But there's nothing left or nothing vested in that elder or in the community. And I think that needs to be raised, and find our way through when we're talking about cultural competency. That might more be institutional based than individual researcher based, and just see where we go from there. Whether we can come up with some templates that we use broadly throughout the province, or this might work for me, a Stalo or a Seabird, but it may not work for my upriver cousins and Catholic people, or going the other way, the Okanagan people. So it's about recognizing that we are different. When we come up with what some of us might view as an ethical model for me and my surrounding communities here, it might be good and fine for us, but doesn't mean you take that as an institute or as an individual researcher and apply it to another people. It may work, it may not. So there's a lot of start-stop there until there's a better institutional recognition of who we are. And it's something I'm struggling with as the president of the First Nations Education Steering Committee, because we are trying to modify how it is advanced education engages with us directly as rights holders to education, as institutes located within our reserves that we're in control of, that recognizes who we are in terms of our rights with regards to the actual provincial legislation on advanced education, or policies to support advanced education here in BC. And so if you're looking at it from the province inward, before we do a deep dive on cultural safety, and cultural safety writ large, it's an entire layer. Now there's a sub-layer called pandemic. Next time there might be a sub-layer called something else. The basis that the public post-secondary institutes are created by legislation, or given authority by legislation, then there should be a high level of cultural competency within that legislation. Well, whether you pull in Article 14 of the Declaration, or Call 56, I think it is, to the calls to action. Because if you find some good legislative space that drives and gives nuanced authorities to public post-secondary institutes that then will trickle down to program areas and research areas and researchers individually. So that over time we move the agenda for, I don't know how many students I've educated over the years, and maybe a handful of First Nations and Métis. I've never been approached by an Inuit. Some French, some Spanish, you know, they're over here studying whatnot, and they engage us. They're interesting conversations to engage. But in that education, it's never institutionalized. That we may educate an individual, but we don't have an opportunity to educate the institution itself. So on a larger question, that's why I talk about that legislative and policy competency, because that'll force, if not encourage, those willing institutes to modify practice, to be more culturally friendly, to be more culturally knowledgeable about us. Not in a pan-Indigenous or pan-Aboriginal approach. It's, you know, we always maintain that our rights are vested in us as a collective, and rights are land-based. So in my backyard here, I've got the University of the Fraser Valley. And over the years, I've been trying to educate and promote with them. Well, you know, yes, you have a large catchment, but you're here in our backyard. First and foremost, you recognize your Stalo, Coast Salish, prioritize us and go through protocols. We welcome students from all over the place, and Métis, there's even a few Inuit there right now. So the part of the cultural competency needs to, it forces a deeper understanding. What are our protocols? It's not only about us as land-based rights holders, it's about our protocols to invite others to come in and participate and contribute, to learn, to work with and support us and whatnot. Well, whether that's research-based or otherwise, because I've been in situations where we've had folks come in, they're working within our communities and within our institutions, but they're not from here, and they're actually the ones being interviewed by researchers on, oh, what is Seabird like? What was Seabird like 50 years ago, 100 years ago, 300 years ago? And our employees are then actually having to come to us and ask us that information, and then they relay it back to the researcher. I go, gee whiz, aren't we beyond that? Why don't you come in directly to us? And it's a good learning experience for those folks that aren't from here and are engaged with us, but it's about that teasing apart some aspects of cultural competency that are nuanced. And for you, Indigenous, and I'll use Indigenous because it applies to all three of us, that's the context of where we come from when we're talking. If you're familiar with us, you're fully ingrained and engrossed. You probably grew up in that same context. And whether you call it a worldview or the lens that we look through, whatever it is, it's different among us, and certainly different between Aboriginal and non-Aboriginal peoples. So the more layers, the more filters, the different lenses that apply to that changes stories quite a bit. And I think for the most part, that speaks to the ethical aspect of what it is that you're seeking out here. Is, well, what is an appropriate ethical approach to collecting information, interpreting it, and then doing what with it? Certainly appreciate the institutes that, or students I've engaged me through institutes. You know, you have the protocols on signing off. What do you give free public access to? What do you give limited access to? Or what do you hold confidential between basically you, the student, their panel, and to some extent the institute. And one good example of that, we had back then, this is going back a little while, a young lady doing a PhD on what we call, or what others call justice, what we call harmony and recreating harmony. And she approached me, and you know, we had really good conversations, because it's one of the things we're passionate about, right? Is how do you create harmony? How do you sustain harmony? And but then we found it problematic over time that she'd go back to her panel back at the institute, and we weren't that panel. So we had basically non-Indigenous people gauging and discussing and rating our information. Some of our information, me and others are passing along, you know, they're literally thousands of years old. So it got to the point where I got frustrated, and this is that ethical aspect. Where are the ethics behind a non-Indigenous person judging Indigenous knowledge? That's a challenge. A few people can do it, yes, but for the most part they can't. So that's an ethical struggle. And to resolve it in this case here, well, we actually worked with that, she and I worked with that postdoc student, or institute, sorry, so that we actually created our own ethics panel here within Stalo country. So she'd go out and do her research, collect the information, come back, report it to us, and mind you, I was just a part of a team. There's elders there, they're way more knowledgeable than me, but I'm always the one being prodded to speak. And particularly when somebody needs to hear something, it's I got to speak kind of thing. So it gave us the ability to really modify the relation between a researcher doing really, well, what I would call really true ethical research on something that's important to us in a way that we're fully participatory in, bridging that to the public post-secondary institute and its truly colonial processes within and whatnot. And it actually came out quite, in my view, quite fruitful, but it's the exception. You really got to push hard for that kind of relation. And quite often it takes just one or two key people being in a certain space at a certain time to push that. So I'm not sure, I didn't catch when we started, so I'm not sure how much time we have left, but I did want to pull that into the pandemic scenario, because going back to our lens, our worldview, we're hard pressed naturally, innately, to have a conversation like this with a researcher doing really comprehensive interviews. Like some interviews I have been in, you know, they're days long at a time, and our elders, our knowledge sharers, I don't call them knowledge keepers because they don't keep the knowledge, they share it, collect it and share it. Our knowledge sharers aren't purposed for that. So there's got to be some mechanism to have some communication dialogue like this, but when you get to the nitty gritty, it really does need to be interpersonal. There's not much interpersonal here in a call like this, but it's an opportunity for us to gather from throughout the province and have this kind of conversation. Looking at some of the activities I do, like writ large, there's all kinds of COVID safety protocols, procedures, policies, methodologies, checks and balances and whatnot that are laced throughout, whether it's a for-profit company or a Crown institute like Trans Mountain, or like Finesse. I'm always told we've got really good COVID policies that, you know, we make available to our 203 communities that they can take and apply to their community. Because it's important to have a really deep understanding of where the community is with regards to COVID. Well, one example here, and we're probably getting close to time, but I'll end this way. The heightened awareness of folks are of COVID. We have a case here, had a case here where, well, one of our staff members, we've got 450 staff. Some of my CBER staff might be on here because I don't know all of them. But the band itself is taking it really seriously, where if you go to a gathering of 10 or more people, you have to self-isolate for 14 days. So if you're in self-isolation and you're on a timeline to have a paper written by a certain time, then you can't invite a researcher into your house or find a place. Then it comes back to this again. Whereas another community might allow you to leave the community, go to a hotel, conference room or something, and have that interpersonal conversation in that kind of space. But I don't think there's any single one answer to any of the questions you folks might be seeking out or posing. It's going to vary by nation, by region, by capacity of communities. A lot of our communities have really high capacity in education. You got multiple PhDs, masters, for example, and others, you know, they celebrate that they've got 2 grade 12 graduates this year, which is well worth celebrating. But you know, it speaks to the diversity, and it's about how is it we build into the institution writ large of research all those things that are nuanced that don't necessarily reflect our culture per se, but they're responsive to it. Every researcher doesn't need to know the answer, but they should be armed with some key questions, some key underlying foundational information around approach, around communications, around body language. I really get a kick out of researchers that don't know us, and you could read them so well with their body language, and they don't even realize it. So I hope that's helpful. For some reason, I had my mindset really centering on COVID here, because you raised pandemic, because COVID is the priority in a lot of the other activities that I'm engaged in right now. But appreciating the opportunity for me to freewheel a little bit on the post-secondary side of research, and what a harmonized, I wouldn't say a standard, but what a harmonized ethic methodology might be with regards to researchers in general, but particularly in times of pandemic, because at least I'm really fearful of, in that dynamic of lack of interpersonal space in those interviewers, what might be lost, what might be viewed or considered by a researcher or by the institute a different way, because we're not there in their face for us to read their body language, and for them to read our expressions and body language as well. So I hope that was helpful.
Thank you. Thank you very much, Tyrone. That was just a really rich and wonderful way to bring us, back together at the end here, and really kind of open up the heart of that conversation on worldviews, and then how we interface with institutions in the time that we're in. So I know you probably have a ton of questions for Tyrone, and I don't know if Reb BC has, a way for people to maybe bring those questions forward at another kind of session, but I do want to give our knowledge keeper and Elder Syexwaliya a chance to speak. I know that she has another engagement with First Nations communities, and so I will just ask her to bring us to a close. And I do want to say thank you to the organizing committee for the many hours of work they've put in, and my appreciation for the volunteers in their organization. There's a feedback survey that will be sent to you at the end of the event to all attendees. And we really want to encourage you to let us know what you want to see in future topics. And I also just wanted to acknowledge the speakers and host organization, the Academic Health Sciences Network of BC, who are making donations to the BC food banks on behalf of our speakers. And also thank you to our esteemed elder and matriarch, Syexwaliya. So I'll just ask her to come up and close us.
Jenquin Mentomi, Namaste, and Jillian and all the team. I've found this afternoon a really interesting conversation, and able to listen to all of you. I do take part in the regional nurses weekly COVID management meetings, and know that they work hard to make sure they get what's required into the communities, and they do get stressed out and want to make sure things go smoothly working with the communities. And I thank Chief Tyrone McNeil. I think I met you at a meeting last year, and at Finesk. And I think that we all need to come together, and I heard it throughout that our old people believe we need to work together and hold each other up and help when we can. And with the pandemic, I found that a lot of young people moved back to growing vegetables and potatoes and things, and started, I see the smoked fish behind the chief. A lot of them started teaching their children how to fish and cut the fish and do the ceremonies that are required. And so even though we say it's a challenging time, it's been a learning and growing time as First Nation. I usually jokingly say, first I was an Indian, then I became a First Nation, then I became an Aboriginal, and now I'm an Indigenous. And I say, well, we say I'm Squamish Stalmach. I'm a Squamish person, Squamish citizen. And so sometimes I use all four, or I don't say Indian anymore, but I say, I want to say First Nation, Aboriginal, Indigenous people, and just throw it all out there. Because that's what Oren Lyons said. Use those words that are recognized in international law, and then you can create the narrative that you need to get what we need as our rights and title and everything. And so thank you for bringing us all together to be in Chomot and Squalwin, one heart and one mind, in Hamalkamalum, Natsamat and Squalwin, because, and I say one heart and one mind because we're all human beings, and we need to share and transfer knowledge and different techniques because our people always adapt it. I found that my grandparents and looking at our history, we always adapted to use what was best in our environment at the time. And so now here we are all on Zoom. So Zoom, Zoom, Zoom. And I just want to thank you all, gang. And thank you to the organizers and all those who have helped fund bringing us together, because today has been worthwhile. And I'm just going to do Snowbird song and a closing prayer, and then turn you back over to Namaste. And I just ask, as I said at the beginning, that you just relax and take a breath, open your hands and feel the energy from Creator and the ancestors and from each other. Ho, 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 hey, ho, ho, hey, ho, hey, ho, hey, ho, hey, ah, hey, ah, Chen Quinn Mantomi Kakakanak Chasiam Yonsion so Chanoyap and Manman to squires to seats. Yonsio Manman Equatal Chet, CII Chet to Squalwin. Asking you, Creator, to watch over and guide and protect each and every one of your children gathered here in this circle today, to help them with their mental, emotional, physical, spiritual well-being and health, and also the well-being and health of their families and friends. Asking you, Creator, to help them as they go about their work as from today and into the future, and leaving that legacy that those behind us can follow and adapt it as needed as we move forward in our life journeys. Asking you, Creator, to hear our prayers for all our family and friends who have serious illnesses, especially with COVID, those who have it or are recovering, those who have cancers and getting treatments, heart problems, diabetes, arthritis, TB, HIV, Hep C, meningitis, and all the other, and flus. Flu is going to be a big one soon. And those with injuries waiting for surgery or have had it, hear our prayers for their health, healing, and recovery. Asking you, Creator, to hear our prayers for all our family and friends who have those traumas, especially multi-generational impact traumas that have caused them to have battles with alcohol and drugs, and those incarcerated because of those battles, that we pray for them to find that healing path to recovery and survive. Especially right now in our communities, in the last few weeks, we've lost a lot of people under 30 to fentanyl opioid crisis. So asking prayers for them, their families, then that they find that healing path to recovery of their battles, to maybe share their story and be a survivor and share their story so others don't walk that dark path or don't start it. And prayers for their families who don't want to lose them. And also, Creator, hear prayers for all our families and communities who have lost loved ones, and know that they always walk with us and send us signs, dragonfly, ladybug, eagle, raven, and that they bring us that uplifting when they need to in that spiritual way. Protect all the children here today, Creator, and bring us together again on another day. Tama Kwetsi Snachum Hoichaka. Those are my words. I'm done. I say, Chen Quinn Mintomi, thank you for letting me share a part of your day. Wachayap yo, you all take care. And I do have to leave because I'm in a session, engagement session with communities in the province with FNHA. So I say, Wachayap yo, hoit maflaf.